before we start, can I have you confirm your name and date of birth for me?
Yeah, it's Madison Orridge, 07/31/1999.
Got it, thank you. So I looked over your chart, so I kind of have an idea of what's going on, but can I hear in your own words just how you're feeling and what's going on right now?
Yeah, I'm just having some like low back pain in my back. Quite recently.
You said low, is it on one side or both sides?
I think it's on both sides. Both sides.
Both sides? Okay, got it. So I have an intervention in mind that I'd like to do with you today using a moist hot pack. But before we do this, I would have to ask you just a couple questions, do a quick screening, and just a couple little tests. Does that sound okay with you?
Yeah.
Okay, so before we do anything, we work on a call bell system, so I'm going to give this to you.
Okay.
So if I need to step away at any point and you need me for anything at all, I want you to give that a nice loud ring and I'll come right back over, okay?
Okay.
Got it. So I just want to start by asking, can you just tell me what year it is?
Yep, it's 2024.
And then who's the president?
President Biden.
Okay, thank you. And then just a couple questions about your history. Do you have any severe heart or lung disease? Any history of the last 5 years of skin cancer or lymphatic cancer?
Nope.
And any long-term steroid therapy?
Nope.
Perfect. So I think that you're a good candidate to do this moist hot pack therapy today. So what that's going to look like is I'll have a hot pack laying here on the bed and I'll have you lay down on it. I think that this is going to be good for you. It's going to help decrease your pain, decrease any muscle spasms or stiffness that you may be experiencing, and get you back to doing your functional activities. Does that sound okay with you?
Yep.
Okay. So what I'm going to have you do, I'm going to have you remove your shoes and take off your shirt for me, and then I'm going to provide you with a straight, and we're going to sit here on the edge of the bed.
Okay.
You okay? Just come behind you here. Alright, so I'm going to start by just inspecting the skin, just making sure that there's no open wounds, no rashes, anything like that. Do you mind if I lower these just a little bit?
Yeah, it's fine.
Alright, everything looks good. And then I'm going to give you just a couple light brushes like this. And when you feel that, say yes. I don't want you to guess, just whenever you feel a light brush, okay?
Okay. Yes. 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 Yes.
Perfect. Alright. So what I'm going to have you do now is I'm going to set you back in the chair just so you're safe while I step away, and then I'll go get that hot pack, okay?
Okay.
Alright, so I'm going to have you go back in that chair. Make sure you ring that call bell if you need me, okay?
Okay.
Alright, I've already got my terry cloth. I'm going to very carefully. We'll just try it this way. I'm gonna get it out. Alright, so I'm just gonna pull this up, just make sure that there's no rips or anything. Alright. Water, let it drip. And then since my patient's going to be laying on this, I just want to make sure that we have 8 to 10 layers to protect their skin. So this counts as 2. There's 1, 2, that's 3, 4, 5, 6, 7, 8. So I'm going to go ahead and take this over. Alright, so I'm going to have you come and sit here on the edge of the bed, and then we're going to get you on your back, okay? Okay. Feeling okay? Mm-hmm. Alright, so go ahead and lie down onto that side, and then we'll get your back. Alright, how do you feel there?
Great.
Okay, so I'm going to just get you in a little different position for some comfort. So I'm going to place this under your arm here. And this one under this arm. And are you able to lift those legs up for me.
Yep.
Two pillows underneath here just to get you close to 90-90. All right, how do you feel there?
Great.
All right. So during this, you should feel just comfortable heat. It shouldn't be too hot. And if it does get too hot or anything just kind of feels off, give that bell a nice loud ring. The heat on the hot pack is gonna reach its max in about 8 minutes. So I'm gonna step away and I'll be back in that 8 minutes to check on you again. And we're gonna lay here for a total of about 20 minutes. That sound okay?
Yep.
Okay, I'll be back to check on you.
Okay.
All right, Miss Madison, it's been the full 20 minutes. How are you feeling?
Good.
All right, so I'm gonna go ahead and get you up, okay?
Okay.
Lift those legs for me. All right, you can rest. And I'm gonna take these. Thank you. All right, well, let's go ahead and sit back up here on the edge of the bed. Feel okay?
Mm-hmm.
All right, so I'm just gonna come back here again and just inspect the skin one more time. Is it okay if I lower these a little bit?
Yeah.
All right, so I'm just checking the skin again. Since we are using heat, it is okay if there's a little bit of redness, but I'm just making sure that there's no like rashes or anything that looks out of the ordinary, but everything looks good here. All right, so I think that we tolerated this treatment well. Would you agree? Do you feel okay?
Yep.
All right.